Dementia is a public health issue that is continuously being seen in the elderly, as well as being the leading cause of dependency and disability. MMC stands for Memory, Mental Health, and Cognition. It is a program that creates a mind-stimulating environment for elderly patients with dementia. Dementia is a serious neurodegenerative disorder that affects memory, behavior, thinking, and even leading to the loss of motor function. Alzheimer's dementia is the most prevalent form of dementia, with around 60 to 70% of patients having it. Patients suffering from dementia are vulnerable to not only cognitive decline, but are also susceptible to depression. It is important for families to ensure that their loved ones are receiving the proper stimulation to maintain cognitive function, keep them content, and decrease depressive symptoms as much as possible. This stimulation is especially essential during the early stages of dementia. An optimal approach to aiding in maintaining cognitive function and possibly slowing down the disease progression of dementia would be our strict Memory, Mental Health, and Cognition program, also known as MMC. This presentation provides information on the proposed MMC novel program that is designed to create a mind-stimulating environment for elderly patients in the early stages of dementia. To start off, the MMC is a set program given and explained to the caregivers who are taking care of patients with dementia. We offer a week trial where our employees come in to aid in the program setup with the caregivers and patients with dementia. This program includes 5 minutes of mindful meditation, 20 minutes of exercise, preferably walking, participating in at least 30 to 40 minutes of crossword puzzles, and doing tactile activities such as towel folding or sorting items for 30 to 40 minutes per day as well. The caregivers will be given an information booklet with detailed descriptions of the program's activities. The caregivers will log each activity done by their loved ones on a daily basis, as well as have the opportunity to record any behavioral and cognitive changes. This program has wonderful benefits since it provides fun and simple activities that patients with dementia can enjoy while promoting concentration and focus on tasks to keep their vulnerable minds busy. It is important to implement these engaging activities into daily routines to ensure constant and receptive stimulation of the brain.
Patients with dementia suffer from cognitive decline and are susceptible to depression, which is why meditation plays a strong role in the MMC program due to its benefits with strengthening the patient's cognition, memory, and positive mental health. Studies suggest that long-term meditation practice reduces psychological stress, enhances attention, increases cognitive reserve capacity, and delays cognitive decline. From these studies, researchers have found that meditation increases cerebral blood flow to various parts of the brain to enhance cognition. In addition, meditation increases the efficiency of white matter in the anterior cingulate cortex, which is a structure associated with self-regulation and control over emotions. To do the mindfulness meditation portion in the MMC program, caregivers are advised to download the Headspace app to follow along with their loved ones. The patient may start off doing daily meditation for 5 minutes per day, before gradually building up to 10 minutes or more. It is best for the patient to be in a quiet room they are comfortable and familiar with, to minimize disruption and discomfort. Caregivers are also given the option to allow a certified mindfulness meditation instructor from the MMC to visit once a week to lead the meditation practice. Caregivers are encouraged to log any behavioral changes in the patient after each session.
Exercise can promote positive mental well-being and cognition. According to research, physical activity provides many benefits in cognitive function, such as improvement of memory, executive functioning, as well as the delay of cognitive decline. There have been multiple studies reporting that people with dementia and higher cardiorespiratory fitness levels are associated with increased whole brain volume and hippocampal volume, as well as lower levels of cardiorespiratory fitness being associated with faster dementia progression over 2 years. Physical activity not only exposes the patients to fresh air and nature to decrease loneliness, increase productivity, and improve mental health, but also increases neurogenesis in the brain to promote cognitive function. Due to the majority of patients with dementia being elderly, we propose that walking outside would be the safest option while still being a sufficient form of physical activity. We suggest 20 minutes of walking outdoors. The caregiver will walk with the patient anywhere, such as the park or around the neighborhood.
According to previously conducted studies, doing crossword puzzles in late life suggests the delayed onset of decline in memory for patients who develop dementia. Doing crossword puzzles in the novel MMC program has benefits due to the cognitive stimulation they provide, as well as being simple but fun and engaging activities for the patients to participate in. These crossword activities will be provided by the MMC program with workbooks dedicated to crossword puzzles, where patients are able to have easy access to these puzzles at any time. These crossword puzzles books will also have themes such as flowers, food, and anything that corresponds to the patient's interests. Additional crossword puzzles will be provided for newspaper articles. Patients are free to do the crossword puzzles for however long they wish per day. However, we recommend doing these activities for at least 30 to 40 minutes a day. With the towel folding, caregivers are advised to take whatever towels they have at home and allow their loved ones to fold them. We encourage the caregivers to fold along with their loved ones to not only assist them, but also to bond with them. When the patients sort items, we recommend caretakers to take miscellaneous objects around the house and allow the patients to sort them accordingly. Patients can also sort these items according to what kind of object it is, such as beads, markers, type of jewelry, and so on. These items can be further sorted by color, shape, size. We also recommend the patients to do the sorting and the towel folding for at least 30 to 40 minutes a day. However, we understand that this time will vary depending on the interest of the patient. In addition, doing tasks such as folding towels and sorting items in the MMC program would not only help make the patients feel productive and strengthen their mental health, but may also assist with slowing down cognitive decline. Studies suggest that folding towels was among the activities with the highest impact on interest and behavioral symptoms, while organizing items was among the activities with the highest level of cognitive functioning. Doing these simple and fun activities in the MMC would keep patients busy and productive, which in turn strengthens cognitive function and strong mental health.
Overall, the MMC program offers an easy and at-home intervention to aid in alleviating the negative effects of dementia. Tactile activities addresses behavioral symptoms as well as maintain the interest of patients. With mindfulness meditation, it looks at mental well-being and cognition. And finally, with exercise, it promotes positive mental health, cognitive function, as well as maintain physical health. This program is a great option for individuals who live at home with their family or at a nursing home facility, as it can be done anytime and anywhere with non-invasive methods and minimal equipment. One of the biggest concerns with dementia is the deterioration of mental health and well-being, which is why the support with depressive symptoms is a large emphasis aside from cognitive stimulation. We understand that loved ones with dementia are vulnerable, and we can assure families that patients participating in this program will be in good hands.